All right, hello and welcome everyone to the August 10th Virginia Opioid Abatement Authority Abatement Academy. My name is Jennifer Nelson, and I'm the Virginia Institute of Government Assistant Director for Membership and Engagement. The Virginia Institute of Government is the leadership development and community engagement arm of the Weldon Cooper Center for Public Service at the University of Virginia. Through our research, leadership development programs, and local government engagement initiatives, we continue to work toward our vision of good governance, equity, and resilience in every Virginia community. VIG offers leadership development through SEI and LEAD, local government equity clinics, certification for treasurers and commissioners of the revenue, and customized training programs. State agencies and local governments can access a range of consultation and support services to build more resilient organizations. We have a team of seasoned public sector leaders and subject matter experts ready and available to facilitate boards of supervisors, city and town councils, leadership team strategic planning retreats, and other related events. Today, VIG is glad to partner with the Virginia Opioid Abatement Authority for the Abatement Academy series, presented every second and fourth Thursday through 2023. A few housekeeping notes. This session will be recorded and posted on the Weldon Cooper Center for Public Services YouTube channel soon. If you have any questions for our speaker, please type them in the chat and I will ask them for you at the end of the session. Thanks again for taking time to join us today for this Abatement Academy session. Now I'm happy to turn things over to Tony McDowell, the Authority's Executive Director. Tony?
Thank you, Jennifer, and welcome everyone. This is the 7th in the series of Opioid Abatement Academy webinars hosted by VIG and the Opioid Abatement Authority. We have 7 more sessions scheduled for this year, and you can see those on our website under Abatement Academy. As you're listening to the presentation today, just keep in mind that we have 2 more sessions coming over the next few weeks focusing on substance use and opioid abatement related issues for youth and adolescents. The next presentation will be on August 24th and will be done by folks from the Fairfax County Community Services Board. And then on September 14th, we're going to hear a presentation about the Recovery Academy in Chesterfield County. So without any further ado, it's my honor to introduce our speaker today, Ms. Januwaa Davis. Jan is the program manager for prevention and wellness services at Horizon Behavioral Health, located in beautiful Lynchburg, Virginia. She's a native of Lynchburg and has worked in the prevention field for the past 23 years. Jan leads several community coalitions that are aimed at increasing protective factors and reducing risk for substance use, mental illness, and trauma across the lifespan. She's committed to eliminating health disparities among marginalized populations, and she's passionate about creating systems, policies, and environments that support the health and well-being of residents in Central Virginia. So I know that Jan has put together a fantastic presentation. I don't want to take up any more of her time, but Jan, on behalf of our organizations, thank you for participating in this and thank you for leading this conversation.
Awesome. Thank you so much, Tony, for having me today. I'm super excited to share with your the participants here today about what Horizon has done and what we have, how we have invested in youth substance use disorder prevention services. And so without further ado, I'll tell you just a little bit about who we are at Horizon. At Horizon, our vision is to provide behavioral health care services that are accessible, consumer-centered, cost-effective, and outcome-based. We provide mental health, intellectual disability, substance use, and co-occurring disorders in our community. And you'll see here our portfolio of services. Horizon Behavioral Health is one of 40 community service boards across the state of Virginia. We offer case management, emergency housing, outpatient prevention, primary care, psychiatric, and school-based services, serving approximately 12,000 clients in our community each year. And so we're very fortunate in prevention to work here at Horizon and to support the efforts of the organization, the mission and vision of our organization. And so according to the Substance Abuse Mental Health Services Organization, prevention activities work to educate and support individuals and communities to prevent the use and misuse of drugs and the development of substance use disorders. Here at Horizon, our prevention efforts focus specifically on substance use, suicide, gambling addiction, and trauma, while promoting mental wellness and resiliency right here in Central Virginia. Our emphasis is placed on building capacity to collaboratively address community needs. We know that no one individual or one organization can meet all the needs of a community alone, and so we really focus on collaborative efforts. So does anyone know who the great philosopher was that is credited with this saying, an ounce of prevention is worth a pound of cure? I can't see the chat, but if you know, type it in the chat. And
No takers yet.
no takers?
Hippocrates?
Nope. Give me two more.
Can I throw my own guess?
Yeah, sure.
Ben Franklin?
Yes, Ben Franklin. Awesome. Yes, Ben Franklin is credited with that quote, an ounce of prevention is worth a pound of cure. It was true many, many years ago when he said it, and it is still true today. I'm going to show you a short video that talks about prevention and just gives you a little bit more insight into what exactly we're trying to do in the area of prevention. So prevention is not about waiting for bad things to happen. It's preventing them from happening in the first place. And work in prevention, many years ago when I first came into the work of prevention, the theme or the thought was that prevention just did fun things. We went out and we did arts and crafts and all sorts of stuff like that. And people really didn't understand that there was science behind the work that we do. And so the field of prevention has come a long ways in the past 23 years that I've been doing this work. And so in utilizing prevention science, we use SAMHSA's strategic prevention framework to guide community coalitions and our planning groups in developing an infrastructure for the needed community-based public health approaches that can lead to effective and sustainable reductions in alcohol, tobacco, and other drug use. Here you'll see the different steps of the strategic prevention framework, which is around assessment, capacity, planning, implementation, and evaluation. One of the beauties about this particular framework is the two pieces that are there in the center, which should be a part of our planning and should be included in every part of the strategic prevention framework. And those are around cultural competence and sustainability. Next, I want to talk to you a little bit about CACA's 7 strategies for community change. The 7 strategies for community change can assist coalitions and planning groups with identifying appropriate and timely action steps to include in a comprehensive action plan or for strategic development, interventions, and implementations. So you'll notice that the first 3 strategies provide information, it enhances skills, provides support. These assist in educating the public, raising awareness, and helping individuals make healthy choices. Generally, they affect a small number of individuals. They may not be helpful if you're working in a community. They may be helpful if you're working in a community where there is denial or limited knowledge about a problem that you're attempting to solve. So they can help provide initial information necessary to bring a community together around an issue. But since these first 3 strategies focus will probably not by themselves achieve measurable change in substance use rates in your community as a whole. So these last 4 strategies are environmental in nature. When utilized in a multi-strategy plan, these are more likely to change the substance use rates in your community. And so the first 3 we talked about around providing information, building skills, providing support, but those last 4 are around enhancing access, reducing barriers. And so those may be things like looking at childcare and transportation and housing and education. The next is around changing consequences. And so it's about incentivizing and disincentivizing. So that may be changes in citations or taxes, or making sure that there's public recognition when people are doing well or organizations are supporting your efforts. The next is around changing physical design, making the environment more susceptible to what you're trying to do. So this is around changing the physical design or structure to reduce the risk or enhance protections. And lastly, the last one is around modifying, changing, and developing policies. These tend to take a little bit more time, but the beauty in these last 4 is they have significant impact on the community at large and not just an individual. So what we're going to do now is get into some of the work that we've been doing at Horizon. This is not exhaustive of all of our prevention efforts. In this presentation, I've tried to focus primarily on the work that we're doing around opioids. And so this here talks about our DART program, which is Data to Action Resource Team. There are multiple state and local organizations that are doing great work of collecting data and creating reports. However, you probably have the same frustration that I do, in that often the data is not provided to the public for months or years later. Additionally, the data is not always comprehensive. It does not paint an entire picture. It doesn't tell you exactly what that means for your community specifically. Sometimes it's statewide data, sometimes it's national data or regional data. And you're like, hey, well, what does that mean for us right here in Lynchburg? So when that happens, it suppresses the community's ability to respond collectively in a timely manner with potentially successful prevention, intervention, treatment, and recovery strategies. This has always been a challenge for me and a place of frustration, but it became even more so during the COVID-19 pandemic, when I was trying to understand, hey, what impact is COVID having on my community as it relates to substance use prevention, treatment, and recovery? And so through that, we decided that we wanted to do something about that, and we wanted to look at this better. So created in 2021 to better understand how societal factors are impacting substance use and mental illness right here in Central Virginia, we partnered with FACT, which is the Framework for Addiction Analysis and Community Transformation, which is a statewide organization. FACT is the Commonwealth of Virginia's premier data analytics platform to tackle the opioid epidemic, and is spearheaded and implemented by the Virginia Department of Criminal Justice. It consolidates on a single platform national, Commonwealth, and local data resources to help its users address the rising tide of substance use. So we thought, what better group than this group who already has their finger on the pulse, for example, that relates to these things. And so we've partnered with them, and they're working with us to help create reports specifically about our community. So the DART team is compiled of individuals representing multiple sectors, including the medical community, behavioral health, schools, law enforcement, the Department of Social Services, domestic violence, housing, and economic development. And so DART is committed to utilizing the data that we get to educate and inform the community, to assist us with identifying and prioritizing needs, aiding in the development of action plans to address contributing factors. It helps us to determine and gain the resources needed to address challenges related to substance use and mental illness in Central Virginia. What we've been so happy about is all of those different sectors that I mentioned, they come and they provide qualitative data to support the report. And then the report also has quantitative data in it. I would encourage you to visit our website at horizonbh.org and look for the prevention tab and look for our latest DART report. The last one came out last year, but we have one coming out on August the 31st that looks at the past year as it relates to substance use and mental illness in Central Virginia. Next, I want to talk to you a little bit about coalition capacity building. When we first started, I talked to you about how a lot of our work, we focus on building capacity to address these issues in a collaborative manner. And so we do that through coalitions. Back in 2017, when we really started to get involved in the area of opioids and trying to better understand how that was impacting our community, there were 3 different groups here in this community who was doing work around opioids. And so I started to attend many of those meetings. And what I learned is that, and you've probably had similar experiences in your communities, and you're probably going to multiple meetings. But what I learned was that there were 3 different groups in our community all doing similar work, but oftentimes didn't know what each other were doing. And also there was quite a bit of duplication of effort. And so for a year, the leaders of those organizations or those coalitions came together once a month and talked about how do we solve those issues. And in 2018, what we decided was to come together under one organization, and that was Central Virginia Addiction and Recovery Resources, established in 2018. The vision for CVAR, which we call it, is a safe and healthier community for all, which I believe is something that everyone can rally against or rally for. What makes us unique is that there are many substance use prevention coalitions that exist all across the state, focusing primarily on prevention. One of the beauties and the things that I'm most proud of about CVAR is CVAR has individuals from prevention, treatment, and recovery all in the same room, all working together and moving in unison. And so that's one of the beauties of CVAR. We have work groups that work on prevention work. We have a treatment work group and also a recovery work group. Another one of the things that is a beauty about coalition work, and one of the things that I'm proud of with CVAR, is we have representation from 12 community sectors. They include youth, parents, the business community, media, schools, other youth serving organizations, law enforcement, religious and fraternal organizations, civic groups, healthcare professionals, and then state and local agencies as well. Another thing, and you're probably sick of me telling you guys that I'm proud of CVAR, but I'm also proud to announce that we are a SAMHSA Drug-Free Communities grant recipient. And so for the past 4 years, we're moving into our 5th year, we have received $125,000 a year to aid in our work around coalition capacity building and youth substance use prevention. So soon we'll be moving into our 5th year and hope to be able to apply for additional funds to take us another 6 to 10 years. Some of the highlights of CVAR is that we've created an online service locator tool that exists on our website at cvarr.org. For those struggling or have a family member that's struggling, this is a comprehensive interactive tool to help people access services. And so we have that. Every year we also do a CEO legislative roundtable where we invite the CEOs of many of the organizations that have substance use as one of their services. We invite them to come to the table along with our legislators. We try to get all of those individuals in the room together who have decision-making authority to talk about what are the current problems, what are the trends, where are their gaps in services, and how do we collectively solve these challenges for our community. And so we do that in the fall of every year. CVAR also partners with Lynchburg City Schools every 2 years to do a survey for 8th, 10th, and 12th grade students. This survey is based on the Center for Disease Control and Prevention's Youth Risk Behavior Survey. And so we do this every year. The main topics addressed in the survey is unintentional injury, tobacco, alcohol, drugs, sexual behaviors, bullying, social supports, healthy lifestyles. And so every 2 years, we get to see what our young people right here in our community are saying that they are involved in. And so that has been really helpful. While we survey our young people in the schools, it is really the goal and the hope is that other community and youth-based organizations will join the school system and using the results of this survey to design and implement prevention, early intervention, and treatment programs aimed at improving the youth of our youth right here in the city of Lynchburg. We also do an annual State of Collaboration event where we look at a review of the accomplishments from the previous year, an unveiling of our local leadership team. We look at our latest substance use trends for our community. We do look at collaborative problem solving and how do we address those. And so that takes place once a year. Currently, we are working on, and CVAR is leading the charge in developing a comprehensive harm reduction site in our community. And so our coalition is working with Virginia Department of Health to hopefully get a CHR up and running here fairly soon. Most recently, the coalition has been doing community conversations on substance use, where we've partnered with Lynchburg Parks and Recreation Neighborhood Centers, where we're going out in the community and meeting with community members at 6 different locations in the city and asking them to come and talk to us about what are they seeing, what are their concerns, how do we collectively solve those issues. Also to hear inspiring stories of recovery. Sometimes we think when people are addicted to substances that it is a life sentence and there's no hope, but we hear inspiring stories of hope as well. And then we help those individuals connect to resources that exist here in the community. And so we've been happy to do that as well. And so that's our CVAR coalition. Also, one of the things that we have is our Healthy Youth Through Prevention and Education HYPE, which is what we call our HYPE Club. This is our peer advocacy club and serves as the youth arm and advisory group for CVAR. High school student members work as a team to develop and implement prevention plans to address substance use in their school and their community. I don't know how old, and I can't see your faces, but if any of you were from the 1990s era in high school during those years, I was in high school in the 90s, and there was a brand called FUBU, or For Us, By Us. And while that brand is long gone, and no one even probably thinks about that brand anymore, they were a little ahead of their time, because when I think about the work that we do, oftentimes we hear, if you're going to be out and you're going to be doing work for a specific demographic or a population of your community, you need to make sure that you're inviting them to the table. And so that's why we work very specifically with young people to better understand how do we meet their needs. This group meets bi-weekly on Friday afternoons. That was not my choice. I do not want to be meeting with young people on Friday afternoons, but because that's when they want to meet and that's when they're most available, that's when we meet. Some of the highlights, the things that they have done over the past couple of years are a Kick the Habit campaign with posters and yard signs and information, all sorts of ways to reach their peers about kicking the habit, and then ending that with a kickball tournament. They've also done a Dodge the Smoke campaign and ending that with a dodgeball tournament. This year, their work really focused primarily on mental health and the mental health being a driver for substance use with their peers. And I will talk to you more about that campaign just a little bit later. Every year in October, they do Red Ribbon Week activities. And then one of the big things that our youth do is they partner with the Coalition for HIV Awareness and Prevention of Central Virginia every year to do a youth summit. And so this youth summit is aimed at empowering our middle and high school students to be leaders, to make healthy choices, and take the lead in their neighborhoods, in their schools, in their churches, and in their churches. This event, this past year, it happens in March of every year. This event covers topics on health, social media safety, goal setting, substance use, making good decisions. And this year we had over 300 young people and their parents present for this event. And so I'm going to talk to you more about how our Hype Club helped to support that event. One of the things that we've learned about working with young people is that we have to stay current and we have to stay creative because it is changing every single day. I'm still a Facebook kind of girl, but that's not where our young people are at. They're on Instagram and Snapchat and TikTok and YouTube. And I just don't quite understand those spaces quite as much. And so we have to make sure that there are people working in our groups that understand young people, understand what is going to be, what is going to attract them, and how do we reach them. Some of the fun things that we've done over the past couple years is we've used a 360 photo booth during Red Ribbon Week. And if you guys know that 360 photo booth, it actually creates like a video of you having fun and having a good time. And what we did last year is we used a 360 photo booth. The young people were able to put on all sorts of fun photo props, but they were also able to hold up signs that said they were drug-free and why they were drug-free and all those things. And then they got a link to their video and they were able to share that with their friends. So you imagine we had probably about 600 unique videos being shared out on those young people's own social media accounts about being alcohol, tobacco, and drug-free during Red Ribbon Week last year, which takes place in October of every year. We've done virtual dance parties because COVID kind of forced us to do that. So we've done virtual dance parties, we've done TikTok challenges, Kahoot trivia challenges, we've done rap battles. And so we always have to be on the cutting edge of creativity to try to figure out how are we going to connect with our young people. What you'll see on this slide, oops, I didn't even know I had moved forward. Here we go. So on this slide, I didn't even know I had gotten there already, but on this particular slide, it talks about our Too Good for Drugs program and evidence-based programming. Whenever possible, prevention planners should select programs or practices that have documented evidence of its effectiveness. The best place to find these evidence-based programs are federal registries such as SAMHSA or the Department of Justice, or peer-reviewed journal articles and things like that. Our program, Too Good for Drugs, is funded by the Virginia Foundation for Healthy Youth, who is a partner with the Virginia Opioid Abatement Authority. VFHY, or Virginia Foundation for Healthy Youth, takes a comprehensive approach to preventing and reducing youth tobacco and nicotine product use and childhood obesity. VFHY recognizes that there are drugs besides tobacco that also pose a serious hazard to youth, opioids being one of those. Most of the evidence-based tobacco, nicotine, and vaping prevention or cessation programs that VFHY supports either specifically discusses the dangers of all the other drugs or provides relevant information about those drugs. And so we're very fortunate to be a recipient of funding from the Virginia Foundation for Healthy Youth. We partner with Lynchburg City Schools to offer the Too Good for Drugs program, the 10-week Too Good for Drugs program in their 9th grade health classes. We serve approximately 650 young people every year in this 10-week program. This past year, about 51% were male, 46% female. And they're about 90% of them between the ages of 14 and 15. And then about 33% white, 46% Black, about 6% Latino. So that's kind of the makeup of the young people that we're serving in this program. Skill development is at the core of the Too Good for Drugs program. Is designed to mitigate the risk factors and enhance protective factors related to alcohol, tobacco, and other drugs. The lessons introduce and develop skills for making healthy choices, building positive friendships, developing self-efficacy, helping young people to learn to communicate effectively, then also helping them to learn to resist peer pressure and other peer influences. It also takes an in-depth exploration around tobacco and nicotine, alcohol, marijuana, and opioids. Here, what you'll see on this screen is our 2022-23 evaluation results, which are pretty consistent with what we've received for the past 14 years of implementing this program. You'll see this at pre-71, from 71% at pre to 93% at post stated that using nicotine, alcohol, marijuana, or other drugs could adversely affect their health. 87% said that from 87% to 98% stated that students their age risk harming their developing brains if they use alcohol, marijuana, or other drugs. And so there are other stats there as well. 98% of the students participating in the Too Good for Drugs program responded that it helped them to become more knowledgeable about drugs, alcohol, tobacco, and their health risk. And so those are some of the data related to our Too Good for Drugs program funded by the Virginia Foundation for Healthy Youth. Oops. I'll tell you a little bit about some of the trainings that we're offering here at Horizon. We're offering Revive, which many of you are probably familiar with, which is the opioid overdose and naloxone education program for the Commonwealth of Virginia. We're providing Narcan and partnering with hospitals and schools and Department of Social Services and Parks and Recreation. And then we're also just doing virtual presentations where anyone can join a virtual presentation that we're doing on Revive, and anyone that attends our Revive trainings also receives free naloxone for attending. We're also providing naloxone out at community events. So if there's an event happening out at the park, we're out at that park and we're providing a rapid Revive training, which is about a 10 to 15 minute training, as well as providing Narcan there. We're also doing mental health first aid trainings here in our community for both youth mental health first aid and adult mental health first aid. And one of the beauties of this is that many of us would know what to do if we saw someone having a heart attack, right? For years, we've all taken CPR. At the very least, we know that we need to call 911, but too few of us would know how to respond if we knew someone was experiencing depression, or if we were concerned that a friend or coworker might have signs of addiction, or if we thought that they may be having suicidal ideations. We may not know exactly what to do. And so mental health first aid is an 8-hour certification course that teaches individuals how to identify, understand, and respond to signs of mental illness and substance use disorders in both youth and young adults. In this class, we're getting teachers and clergy members and coaches and healthcare workers and human service workers, or even first responders and veterans all come into this class because maybe they're concerned about their neighbor, or they're concerned about their child or a friend. And so we're offering that 8-hour certification course to community members. We're also offering a 3-hour course called Understanding ACEs, which is a part of the ACE interface training. We're offering that to our community members as well. Understanding ACEs is changing the consciousness, I think, of communities. It's happening in our community, but also across Virginia. It's really changing the way that we think about ourselves and think about the people around us. We know that for many people have experienced adverse childhood experiences at some point in their life. The effects of ACEs on the developing brain leads to a likelihood of feeling depressed, of feeling anxious, of having difficulty concentrating. And so it is rare that you would not find a person using drugs who do not also have ACEs. And so if we think about it, the drug itself is not the problem. For many, it is the solution. And for many, it takes away the pain, it numbs the pain. And so using substances may be a way to self-medicate and cope. And so if you haven't had a chance to dive into the work around ACEs and understand how adverse childhood experiences affect a multitude of health behaviors, I would encourage you to attend one of those trainings. We're also doing Hidden in Plain Sight, where we set up a bedroom, a mock bedroom. We partner with law enforcement, and we have parents come in and talk to them about what they should be looking for, what things in a child's room may indicate, or what behaviors may indicate that their child may be involved in substance use, may have mental, maybe struggling with their mental health, and how do they get support for their young person. Additional events that we've been doing, and as a way to raise awareness, is National Fentanyl Awareness Day. On May the 7th, we do some work around that every year. International Overdose Awareness Day is coming up on August 31st, in which we will be set up at 5 different Walmarts in our community with our local EMS, and providing Revive training on the site. On site, as well as providing Narcan. We've also done an event where we really looked at how addiction impacts families. And so we had an event on that. We've also had an event where the Responding in Faith Summit. This event, which took place in November of last year, was designed to bridge the gap between faith-based communities and behavioral healthcare organizations' ability to collaboratively respond to the community's growing mental health and substance use needs. Every year, we also partner with CVAR to do an annual Walk for Recovery, where we are encouraging individuals to come out to walk to celebrate the individuals in recovery, to help us to reduce the stigma often associated with the disease of addiction. And so that's a big event that takes place every year in our community as well. Also want to talk to you about our safe storage and disposal efforts. We have provided permanent medication drop boxes in our community. And so we did that with the Abatement Sheriff's Department and the Alta Vista Police Department. And so we've put in permanent drop boxes where their community members can come in at any time and dispose of unwanted or unused medications. We also provide free medication lock boxes to anyone in our community that needs them. And so these are those. And so anyone in the community who needs a medication lockbox, we are providing those to them free of charge. We're also trying to get out as many of these medication disposal bags into the community as possible, and encouraging individuals to get that unwanted or unused medication out of their medicine cabinets and dispose of it in a safe way. We've also done pharmacy bag inserts as well as pharmacy bags. And so all 4 of our Krogers and many of our independent pharmacies, we've given these pharmacy bags to. And so the bags are wrapped with information around safe storage and disposal. The front says, "Be aware, don't share." And then the back has all sorts of information on how to dispose of medications, how to keep track of them, and how to keep them locked, and that type of information. And so we gave these to Kroger pharmacies as well as independent pharmacies to use as their bags to put their prescriptions in. We're doing Drug Take Back every year in April and October, partnering with 7 local law enforcement agencies. I'm sure many of you guys are familiar with Drug Take Back Day, which provides a safe, convenient, and responsible means of disposing prescription drugs while also educating the community about the potential effects of abusive medications. Here, I want to share with you one of our videos that we did recently on prescription drug misuse in the home.
Help make your neighborhood a safer place for everyone by preventing prescription misuse in your home. Here are 5 things you can do. 5. Read medication labels and use as prescribed. 4. Store medications properly. 3. Safely dispose of unneeded and expired medications. 2. Know the facts. Misuse of medication can lead to addiction, overdose, emergencies, and death. 1. Learn more. Visit abovethehigh.org. Help make your neighborhood.
So moving to talking about our awareness campaigns, we have done a number of awareness campaigns over the years. I've shared with you some of the media platforms that we've used for those campaigns, which has been television and radio and billboards, which are the normal ones that we tend to think of. But we've also done bus ads and movie theater ads, where when someone's in a movie theater looking at the upcoming movies, our ad pops up. Also gas pumps. There's several gas pumps in our community that have the little televisions there, and we've put advertising there. Direct mail advertising, and then OTT advertising, where our advertisements come up when someone is watching maybe YouTube or Netflix or something like that. I've also listed some of the different places where we've included information to get to our website and swag materials. So you'll see some of the different swag that we've used over the years. I'm also share with you our 2023 fentanyl awareness campaign. Beginning in 2018, our awareness campaigns primarily focused on the risk of addiction with prescription painkillers, safe storage, and disposal was pretty the message that we have been sending the past few years. Last year, we shifted our message to include specific messaging around fentanyl. And so I'll show you this year's video.
Opioids, stimulants, meth, marijuana, and heroin laced with fentanyl are showing up in Lynchburg and surrounding counties and are increasingly linked with unintended overdose. Even fake prescription pills can be contaminated with fentanyl. An amount the size of a few grains of salt can be deadly. Learn more about how you or your loved ones can protect yourselves from fentanyl at abovethehigh.org.
Whoops. Earlier, I was talking to you all about our youth mental health media campaign with our Hype Club. Last year's Hype Club members identified poor mental health as being the biggest driver for youth substance use. Subsequently, they implemented a youth mental health awareness campaign. The campaign included a youth-led panel discussion at the Youth Summit for both parents and youth. And so I was so proud of our young people. They got up in front of a room of 300 people and led a panel discussion on youth mental health. They also went into what we call the Parents Corner and had a conversation with parents about how to support their young person's mental health. It also included a 30-second video that aired on cable television networks and streaming services, as well as the yard signs that you see them holding up in this picture. And so these yard signs were placed at our middle and high schools, as well as other various high traffic areas across our city. And so I'll show you the video.
1 in 5 youth struggle with mental health challenges. Teens who struggle with mental health often turn to alcohol, drugs, and tobacco. Talk to us. Our future depends on it. 1 in 5.
So our our young people were the ones who led the charge on what did they want in the video, what messages needed to be sent. And they spent several months working with, and let me just go back here. What you'll see here at the bottom is the media company that we work with and their contact information if you're interested. But our young people work with Media Partners Incorporated to create that campaign. You've also heard us mention throughout this presentation about our abovethehigh.org website. It's a local place where our community can come to get information. Under this Just For You tab, there's information there for youth. There's information there for caring adults, older adults, and our faith community. But there's lots of resources in this particular page. There's information on addiction and how you can get help, where people can learn more about all the different substances. They can learn about how they can obtain naloxone, when the next Revive training is happening in our community, how they can get their hands on some of our safe storage devices and that type of thing. It also talks about stigma and language and how the impact that has on this overcoming stigma section. And then under the stay connected section, it talks about how to get involved in coalition work, as well as how they can attend and get involved in some of the training opportunities that we have available to the community. Here's just some of the key prevention initiatives that we have had over the past year. We collected 738 pounds of prescription drugs through our drug take-back events. We've given out 181 medication lock boxes last year, 701 medication disposal bags. We trained 307 community members in understanding ACEs. And then we've provided Revive or opioid overdose response training to 324 individuals in our community and prescribe free Narcan to each of them. In closing, I'll leave you with this. There comes a point when we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in by Desmond Tutu. And finally, I just want to remind you that there are 40 community service boards across the state, and each of them are doing great work around opioid and overdose prevention under the leadership, funding, and guidance of the Virginia Office of Behavioral Health Wellness. I would encourage you to reach out to them for partnership opportunities. I would like to thank the Virginia Opioid Abatement Authority for the opportunity to share about Horizon Behavioral Health's investment in youth prevention. Thank you to the Virginia Foundation for Healthy Youth for funding our Too Good for Drugs program and Hype Club initiatives. Thank you to our community partners for believing in the power of collaboration. And lastly, thank you for being here today. I'll turn it back over to the Virginia Opioid Abatement Authority.
Dan, thank you so much for taking the time to share the story of how you're affecting folks in your community, especially the young folks, and educating parents about what to do and how to help and how to be present for those with use disorders. We are welcome. Janet has opened up her time to answer any questions you might have. We did have a couple people saying that oh, now I lost it. That this person has seen the Hidden in Plain Sight demonstration and would highly recommend it to everyone.
Awesome, thank you.
We're not having any more questions, but I did want to also follow up on what Tony was saying earlier about the Virginia Opioid Abatement Academy. 7 more sessions, a lot of great subjects we're going to tackle. So I'd highly recommend to block off some time on the 2nd and 4th Thursday of every month, and we'll hang out together and listen about how we can be better for our community. Tony, anything else you would like to add?
Thank you, Jennifer, and thank you especially to Jan for a really great presentation. It's obviously that you put a lot of time and effort not only into what you do in the community, but that was reflected in the fact that you put together such a great presentation for this audience today. I'll just reiterate that for any organizations that are interested in advocating programs for youth that are evidence-based and proven to be successful, we would definitely steer you to the Virginia Foundation for Healthy Youth. And again, please come back and join us in 2 weeks on August 24th for a presentation titled Youth and Adolescents Substance Use Prevention Strategies in Northern Virginia. I think it's going to be a great presentation. You'll probably hear a number of things that are in common from what Jan shared with us today, and really emerging best practices that can be implemented across the Commonwealth. With that, thank you again for joining us at this webinar, and hope to see you in a couple of weeks. Thank you.
Thank you.
Thank you, everyone.